Welcome back to our channel. Today we're talking about long COVID, a condition that's affecting millions of people worldwide. We have with us a functional medical doctor, Dr. Miriam, who has successfully treated patients with long COVID symptoms.
Hi, my name is Dr. Miriam. I am a doctor at Miskawaan Health Clinic.
Dr. Miriam, can you explain what long COVID is and how does it present?
So, long COVID is a condition that affects people who have had COVID-19 and continue to experience symptoms for weeks or months after their initial infection. The symptom can vary from person to person, but most common ones include fatigue, shortness of breath, lack of energy, and brain fog.
That sounds challenging to deal with. What causes these symptoms and why do they persist?
Well, it's complicated, but simply COVID-19 is the cause. It primarily attacks the lungs, but can also affect other parts of the body. When infected with COVID-19, the immune system responds by deploying specialized cells to fight the infection, leaving the immune system depleted and in need of recovery post-COVID. This can leave the immune system open to reinfection or reactivating latent infections such as Epstein-Barr virus or EBV. Studies have shown that the immune system damage from COVID-19 can continue for up to 6 months before returning to normal levels. During this time, patients are susceptible to conditions now collectively referred to as a long COVID.
That's fascinating. Can you tell us more about the symptoms of long COVID?
Sure. In addition to the symptom that I mentioned earlier, long COVID patients can also experience fever during exercise, lack of power when exercising, muscle and joint pain, and a nervous system regulation issue that results in palpitation even at rest.
That sounds like a lot to handle. I can understand that Miskawaan Health Group has a unique approach to treating long COVID. Can you tell us a bit about that?
Yes, we do. Miskawaan Health Group approach to treating long COVID is based on personalized care. We understand that each patient is unique and requires an individualized approach to ensure successful restoration and rehabilitation. Recovery at its core requires rest, building back into exercise routines, and refining the approach to nutrition. We have a defined path of investigation to prepare your personalized roadmap out of long COVID.
That's very interesting. Can you walk us through the process?
Sure. So we start by testing for the viruses in the saliva, which help us develop all the targeted MSG proprietary IV treatment, which we treat for the symptoms like inflammation, vitamin and minerals, amino acid deficiencies, specific to the results. And we also test for the activation of the EBV in B cell. So what is the B cell? B cell is one of our white blood cells immune system. And if the test come back positive, we offer our personalized EBV treatment. And we also test for other organ systems like thyroid, adrenals, hormones, and neurotransmitters, which can be completely exhausted after several viral infections. Then we develop a hormone replacement therapies or adrenal support for the patient. And we also look at the microbiome and gut inflammation, which can be damaged by antibiotics and have a significant impact on the brain function. Finally, we test for the mitochondrial function and offer a target therapies for restore and encourage mitochondrial cells.
Wow, that's very comprehensive. How effective is the approach and what are the success rates like?
Well, our personalized approach has been successful in treating patients suffering from these significant ongoing symptoms following this viral infection. And we have observed enormous improvement in our patient health as a result of our treatment.
Well, that's all for today's interview with Dr. Miriam. We hope you found the information about long COVID helpful and informative. If you're experiencing persistent symptoms after a COVID-19 infection, it's important to seek medical attention and receive proper care. Miskawaan is a leading healthcare provider and has treatments for long COVID along with other chronic conditions. Thanks for tuning in and we'll see you next time.
Remember to subscribe, like the videos, leave comment and feedback. Bye-bye.